Containing the fear, the country and the world is on edge tonight. As the coronavirus outbreak continues to spread, the World Health Organization says it has reached a crucial point. The global death toll now topping 3,000, with large spikes of new cases in Iran, Italy, and Germany. And today, officials in Washington state confirming 6 deaths related to that virus, the governor declaring a state of emergency. Good evening. Mi Jung is off tonight while BC health officials have worked diligently to identify and isolate COVID-19 patients here. It is now believed the virus spread undetected in Washington state for weeks. The question, could British Columbia's efforts be undermined by cross-border travelers from Metro Vancouver unknowingly bringing that virus back? CTV's Shannon Patterson reports.
A resident of the Life Care Center of Kirkland is wheeled out on a stretcher and taken to hospital for treatment. 5 of Washington State's 6 coronavirus deaths came from this Seattle area nursing home.
This infection can cause very serious disease in people, particularly people who are older and have underlying health conditions.
The majority of Washington's 18 positive cases had not traveled internationally.
We now know that the virus is actively spreading in some communities here in Washington.
While none of the patients are from the county closest to the BC border.
Given the movement of people around our state, it is possible the virus is spreading in other counties too.
We will see more cases in Washington state. They have not been doing the testing that we've been doing, so they're playing catch up in terms of finding people.
But BC's health minister says we can't turn our backs on our neighbors to the south.
We're going to continue to have a low threshold for testing, and we're going to continue to support our neighbors. And if this tells us anything, is that we live in an interconnected world, and the fact that we need to support other countries and other jurisdictions as well as ourselves is in our self-interest. It's the right thing to do, but it's also in our self-interest.
Dick says the outbreak in Washington state won't change containment measures here.
We have to identify, isolate, and ensure that people do their part by ensuring that their hands are washed and that they do not go to work if they're sick, go to school if they're sick, or go to hospitals or long-term care to visit people if they're sick.
In Washington, the government just bought a motel and modular housing units to quarantine infected patients.
We expect the number of cases will continue to increase in the coming days and weeks. The risk for all of us of becoming infected will be increasing.
And with BC just across the border, the risk may be increasing here too. Shannon Patterson, CTV News.